Knock, knock, knock. Hello, my name is Erica. I'm going to be the RN today for you. I'm going to change your dressing for your Metaport. Can I verify your full name and date of birth? Okay. So I'm going to provide privacy. Did you have any questions? All right, I'm just going to go wash my hands. And get a set of gloves. All right, washing my hands. All right, I'm going to get a set of gloves. Okay, I'm going to move this trash can next to me so that I can throw away stuff as I need to. I'm going to bring my supplies. I'm going to gather all my supplies. I'm going to use these 2 tables for my supplies. Okay. I'm going to put on my gloves. And now I am going to disconnect you from the IV tubing. Okay. And now I'm going to remove your dressing. And I'm making sure to be careful with the catheter while I'm removing your dressing. All right. I don't see any redness or any type of irritation or rash or anything while I'm removing your dressing. I'm going to drop everything in my little trash can. And now I'm going to go wash my hands. All right. I am going to open up my supplies. And I make sure that once I have the sterile field, I don't ever turn my back to the sterile field. Okay, and I got my sterile marker, and I'm going to drop it on my sterile field. So I can make sure I can label everything at the end. And then I have my little cap. And the lumen. Okay. And I brought you a mask. So I'm going to put the mask on you. And then I'm going to lift up the bed for my back. All right, so I already washed my hands. So what I'm going to do now is I'm going to open up my sterile gloves. And again, your dressing change should be done every 7 days. And that's going to help reduce risk of infection. All right, so I'm going to just gather all my little supplies here. I'm going to drop this because I don't need the sterile gloves. This hand sanitizer, I'm going to drop that because I already washed my hands, so I don't need that. I put a mask on you, and I have a mask on, so I'm going to drop that there. That's another set of hand sanitizer and gloves. I'm going to drop all that over there. And I'm just going to line up my sterile field in order of how I'm going to use everything. So all right, I'm going to put down this pad so that we have our sterile field over there. The first thing I'm going to do is I am going to clean the site. I'm going to crack this open first, make sure all the liquid comes down and it's nice and wet while I'm cleaning the site. And I'm making sure that I'm holding on to the catheter and protecting it. I'm scrubbing for 30 seconds. I want to make sure that we clean really good because we want to reduce risk of infection. All right, and now I'm going to drop this behind me. The next thing I'm going to do is I'm going to apply skin protectant. I made sure I let the cleaning solution dry first before I apply this skin protectant. And I'm going to scrub this on there, making sure I get the skin nice and moist. And I'm going to allow that to dry. Now I am going to apply the dressing that we need. I'm gonna make sure everything is secure when I apply the dressing. The catheter looks secure. I got the antimicrobial disc is right here. Okay, make sure that's good. I take all the little tape and stuff off. When I secure it. Take all the little tape off, and then I'll put this one to secure the catheter. And I'm gonna put this one at the end to secure the catheter, and I'm going to put my name and date, time, initials on the end of that. Then I'm going to attach my lumen, and with the clean caps, these are brand new clean caps that I'm attaching on there. So I'm gonna put all of that stuff there, and then what I'm going to do is I am going to I'll do this at the end where I put my name and stuff. Everything's attached, and I'm still gonna use my sterile gloves because I just wanna open up the alcohol, and I'm going to clean the catheter lumen and where I'm going to put the caps at vigorously. Make sure all that is clean before I put the end cap. Okay, that's clean. Now I'm going to screw the little end cap on. We want to keep the system closed because we want to prevent it from... Oh, I'm sorry. I'm not going to put the end cap on yet. I'm going to leave that right there. I'm going to flush first. Alright, I'm gonna move this, get all the air out of the flush. You don't want to put no air. And then while I'm flushing, I'm moving in a pulsating motion, making sure that there's no blood clots and that the line is patent. Okay, that's good. I empty the whole syringe in there, flush the whole syringe, cc syringe in there. Okay, now I'm putting the cap back on. Okay, now I am going to remove the paper. I'm going to pretend like I'm moving the paper because now it's stuck to all it's really on their arm, but I'm pretending like I'm moving the paper. And I'm going to put the bed down. I am going to go wash my hands. Okay, I'm gonna remove the mask, and then I am going to connect you back to your IV tubing. I didn't see any redness or swelling. Did you have any pain? Okay, good. I'm glad that you didn't have any pain. And I'm gonna leave the call night next to you. Did you need me to do anything? Okay. All right. Thank you. Okay. Bye.